Hello, and welcome to Women's Health. My name is Kathy Ermacher. I use she, her pronouns, and I am currently serving as the president of the Women's Foundation, which is the organization, a nonprofit organization that funds these programs. I'm also the past chair of the Commission on Women and Gender. I'm joined today by Guadalupe Esquivel, who is also a member of the foundation and the commission, and Johnny Redd, who is here from out Nebraska. But I wanted to tell you that today our topic is the mental and physical health concerns of the LGBTQ plus community. And I thought I would start out with a quote by BetterUp.com that says, "It is important to understand how systemic prejudice against sexual minorities takes a toll that leads to disparities in LGBTQ health and well-being." I'm going to turn it over to Guadalupe to get us started on our first question.
Thank you so much, Kathy. Hello, my name is Guadalupe Esquivel. I use she, her pronouns, and I'm very proud to be able to serve on the Commission for Women and Gender and the Women's Foundation here in Lincoln. And we're joined today by Johnny Redd. Johnny, thank you so much for being here. Would you mind introducing yourself and telling us a little bit about Out Nebraska, the organization that you work with?
Absolutely. So my name is Johnny Redd. I'm the communications manager here at Out Nebraska. And our mission is to advocate, celebrate, educate, and empower LGBTQ Nebraskans across the state.
Some fantastic organization. And let's get right into it, Johnny. So what do you see as the biggest physical health concerns in the LGBTQ plus community?
That's a great question. It's also a big question. So LGBTQ Americans and Nebraskans especially face, a lot of higher risks of many conditions that impact the ability to thrive and live a full and impactful life. So these conditions include, negative mental health outcomes like depression, anxiety, eating disorders, other mood disorders, that type of thing. This can be rooted in like bullying at school, negative depictions in the media, an unsupportive home environment, that type of thing all compounds those disorders. There's also higher risks of substance abuse issues, addiction. These may be coping mechanisms for people who face struggles like abuse, homelessness, discrimination in their everyday life due to their gender identity or sexual orientation. Also, alcohol and tobacco companies often advertise directly to the LGBTQ community. They're targeted in those ads. And then another issue that, LGBTQ people face at higher rates are STIs, HIV, that type of thing, other sexually transmitted diseases. And it's important to highlight that these rates are even higher among Black and Latino members of our community due to systemic inequities in our healthcare system and our society at large. There's still an immense amount of stigma around STIs, STDs, HIV, and AIDS. There's also a lack of inclusive sex ed in our education system, which is why it's so important to push for those robust sex education programs that explicitly include queer and transgender people.
Absolutely. Thank you so much for outlining those major concerns. Are there any other physical health challenges that you think are often left out of the conversation?
I've known that cancer can be a real concern too, and I'm wondering if that isn't mostly because some of the LGBTQ community don't go to get screenings as fast as other people maybe do. That might be a concern as well.
So there are also higher rates of disorders like you said, heart disease, cancer, that type of thing, those more physical conditions, and that's because people are maybe afraid to go to a provider in the past because maybe they've had negative interactions. There also may be other factors that contribute to these risks, like stigma around these topics, lack of research and awareness among physicians. So there are a lot of compounding factors.
Yeah, you really outlined a lot of those factors that may make someone be hesitant to seek out that medical care, right? Stigma is definitely a huge one. It's important to have culturally competent care. Are there any other obstacles that you can think of when it comes to being able to access that care? And then when you actually do go to a doctor's office, what are some of those obstacles that you might encounter?
Yeah, so another obstacle is just having the economic means to access healthcare. So LGBTQ people are less likely to have healthcare, like health insurance, and they're also less likely to have access to paid sick leave, which allows them to take time off to care for themselves or their families. And there are a lot of non-traditional family structures within the LGBTQ community, so those types of things like health insurance, paid sick leave are not as built into benefits in employment for LGBTQ people. As far as physically going to your doctor's office, many LGBTQ people will face discrimination or whether it's intentional or not from providers that maybe aren't trained in that culturally competent care that you mentioned. This can range from anything like maybe a provider using the wrong pronouns for a transgender person, not even understanding like those types of barriers, as well as just facing outright discrimination from providers that maybe feel like they don't have to provide that care to people.
Yeah, and Johnny, let me actually ask you, just to make sure we outline this, what does LGBTQ stand for, and you brought up pronouns, what is the importance of being able to use those pronouns?
Absolutely. So LGBTQ stands for lesbian, gay, bisexual, transgender, and queer, and then the plus kind of encompasses everything else. And pronouns are just a way of referring to yourself and others without using a name. So like I use they, them, so you would say they went to the doctor's office. With Guadalupe, you use she, her, so it would be she went to the doctor's office, that type of thing. It's pretty straightforward, but it's very crucial in affirming LGBTQ people, because if you transition, you may use a different set of pronouns, or you may use a mixed set of pronouns. So it's especially important that providers are educated on that.
Gotcha. That makes a lot of sense. Thank you, Johnny. And this has been a major conversation that we've been seeing across the nation, and especially right here at home, the gender affirming care conversation when it comes to healthcare. So what are gender affirming care services, and what is available here in Nebraska at this time?
Yeah, so first I can kind of outline what gender affirming care is, and I have a definition here from Nebraska Medicine, which is one of the main larger providers in Nebraska. So gender affirming care is a combination of social, legal, and medical measures that help people feel happy, healthy, and safe in their gender. It is a comprehensive approach to ensuring a person's mental and physical needs surrounding their gender identity and expressions are met. So some examples of gender affirming care include hormone therapy, certain affirming surgery procedures, and then also some behavioral health care as well, to make sure that people's mental needs are met as well as their physical.
And here in Nebraska, what does that landscape currently look like?
Adults in Nebraska with the economic means are able to access this gender affirming care from a handful of providers in the state. It is pretty difficult to access because the LGBTQ community tends to not be in that higher income bracket, or again, not have health insurance. And then often some health insurance does not cover gender affirming care or procedures. So that can be difficult to access.
And for children?
Yeah, so that's a whole other issue. So we've seen a rise in laws that target the types of care that was previously available for transgender youth and their families who are accessing this care. There was recently a law passed in Nebraska, I believe last year, that this care is still technically available, but under very, very stringent guidelines. And it's also important to note that this care was already very difficult to access and was already extremely regulated. And while this care is still technically accessible to trans youth and their families, these guidelines put forward by the Department of Health and Human Services are extremely restrictive, and they make families of trans youth jump through many, many more hoops, and they exacerbate these existing barriers that already existed, including socioeconomic factors, whether or not you live in an area that has providers. So we've seen barriers exacerbated in rural communities because one of the requirements was that providers administer certain prescriptions. rather than people or these youth being able to take those prescriptions at home. So that's an example of one of these barriers that has been really, really difficult for our community.
Yeah, and I know that Out Nebraska does a lot of great work to be able to help families and help those young LGBTQ plus Nebraskans be able to navigate this care in a way that prioritizes their safety, their well-being, and really just helps them thrive, helps them grow up safe and successful there. So definitely visiting outnebraska.org to learn a little bit more about that.
Yeah, and I love that you say helping them thrive because, gender affirming care is associated with numerous health benefits and mental health benefits across the board, especially for youth. It's crucial that they get this care.
Yeah, absolutely. So another big discussion that we've been seeing a lot in our communities is reproductive freedoms. So LGBTQ plus communities are often left out of discussions when it comes to reproductive health care. But this is a very real conversation that needs to happen. It impacts people everywhere. What are some of the concerns that we're seeing when it comes to accessing reproductive health care and abortion services?
Yeah, that's a great question. So I think a lot of the time we think about access to reproductive health care as a women's issue, and often, without meaning to, people often leave trans people and queer people at large out of the conversation. So there are a lot of reasons why LGBTQ people might need to access this kind of care, whether it be access to abortion or whether it just be reproductive care in general, like contraceptives, sexual health screenings, that type of thing. It's important that transgender Nebraskans are included in the conversation about bodily autonomy because these restrictions that we've seen in Nebraska were taken from the exact same playbook as the war on reproductive health was also the same playbook on the war on trans people.
It's all very closely
connected.
Yes,
exactly. It's at the end of the day, bodily autonomy is the most important thing.
So let's turn to a statement by the National Alliance on Mental Illness that they have stated that LGBTQ plus adults are twice as likely to experience mental health concerns and transgender adults 4 times more likely. So what do you think are the major mental health concerns in the community right now?
Yeah, that's a great question. So I would say that a lot of these factors can be put under the umbrella of minority stress. Minority stress is the stress encountered by someone based on their race, sexual orientation, gender identity, as well as other marginalized identities. So it tends to be like chronic in nature because it's centered on a facet of someone's existence that they cannot change. So minority stress definitely impacts the LGBTQ community, which leads to higher risks of all the conditions that we've previously talked about. So we need to push for more access to mental health care in the community, but as well as pushing for policy that lessens those factors that contribute to those negative outcomes. So, pushing for non-discrimination protections that explicitly protect LGBTQ Nebraskans, access to paid sick leave. We talked about sex ed and inclusion in that arena, and increased access to free or low-cost sexual health services. So all of those combine to decrease the mental load that is on LGBTQ people. So when we push for full inclusion and celebration of a group in society, we then start to see those risk factors for mental health, negative mental health outcomes decrease.
And we often forget that there might be some generational differences across these communities, right? So when we're looking at younger LGBTQ plus Nebraskans and older LGBTQ plus Nebraskans, what are some of the factors that we also want to take into account that can impact their health?
That's a great question. So I'll start with youth. We see that LGBTQ youth are at higher rates for negative mental health outcomes. So that includes, again, like we mentioned, things like depression, anxiety, eating disorders, as well as a higher risk of suicidality. And that's really concerning to see that these kids are feeling that way. So something that we push for a lot is to really encourage adults who have LGBTQ kids in their life to do the research that they need to do to become affirming adults and to become safe adults and askable adults on these kinds of questions. So there's a lot of resources out there that we'll get to in a little bit. But as far as the older population and aging population, they face some different challenges. So that can include things like loneliness and isolation, as well as higher risks or higher numbers of HIV, as some leftover things from the AIDS epidemic in the 80s. So that's really difficult, and those compound on each other as well. And they may face discrimination in facility like assisted living facilities and retirement homes, that type of thing. So it's important again to push for policies that protect these folks in our community, explicitly outlining these protections so that healthcare workers know what is expected of them.
Yeah, thank you for outlining that, Johnny. It's really important that we remember that our health is very holistic. There are so many different elements that go into it. So being able to really push for a very well-rounded approach to this is so important. What are some places that you would recommend folks go to be able to find that information for approaching this and to be able to support their loved ones?
Absolutely. So I would definitely encourage people to check out the Trevor Project. So the Trevor Project does a lot of advocacy and education work around specifically LGBTQ youth. So they have tons of resources on supporting and affirming LGBTQ youth, and especially they will have information on like mental health resources as well. We also created a fact sheet with Nebraska Appleseed and ACLU of Nebraska that outlines the current landscape of gender affirming care for youth in Nebraska following the policy that was passed previously. For the aging population, I would encourage folks to plug into SAGE, which is an organization that does a lot of work around aging LGBTQ people. And then for local resources, we actually have a resources section on outnebraska.org. It has some local support groups, it has fact sheets for some of the issues that we've talked about, and also some more links to other organizations around the issues that we've discussed today.
Well, thank you so much. This has been very informative, and we really do encourage all of you to look at the resources that will be listed at the end of this program, and then to contact Out Nebraska or the Women's Foundation if you have specific questions. Again, I want to thank Johnny and Guadalupe for joining us today. This has been very informative. This program is provided to you by the Women's Foundation of Lincoln and Lancaster County. Our website is lincolnwomen.org, and our health programs are all archived on the YouTube channel that's attached to our website. We want to thank all of our viewers for joining in today. This has been Women's Health.